Through this video, we aim to educate the general public on how artificial intelligence, commonly known as AI, helps in healthcare diagnoses. Some of you may have heard the phrase AI, but still may not fully understand what it really is. Well, AI stands for artificial intelligence, and it is basically the intelligence of machines or softwares, not the intelligence of human beings. It's the creation of systems that are able to carry out tasks that normally need human intelligence. AI makes use of a variety of methods like robotics, computer vision, natural language processing, deep learning, and machine learning. As artificial intelligence expands into various fields across various disciplines, such as education and business, it is a promising future addition to the healthcare field as well. There are many roles within that have the opportunity for enhancement, including pharmaceutical entities, patient and provider interactions, patient care and accessibility, and diagnoses. There's research that shows that AI can often outperform humans at certain tasks, an example showing AI detecting tumors more accurately than radiologists. While this may provide opportunity for many benefits, there are also costs, as AI or any machine cannot replace human interaction or connection to some degree. Today we will explore what AI really means for healthcare today and in the future. One of the most common forms of AI is called machine learning, a statistical technique where models are fitted to data and are able to learn from data to provide subsequent generalized suggestions in response to new data. Where this would come into healthcare AI is through precision medicine, where the AI would be able to recommend the best course of treatment based on a variety of factors like patient attributes and treatment context. The most complex forms of machine learning involve deep learning, which includes many levels of variables and are much more complex to be able to predict outcomes. An example of an application of deep learning could be the detection of potentially cancerous matter on radiology scans, allowing evaluation of the human body at a level far more advanced than just the human eye. Another key feature of AI is natural language processing. This includes speech recognition, text analysis, and translation, among many other things. In healthcare, this can be applied through understanding and classifying clinical documentation and published research. Beyond this, natural language processing can analyze clinical notes, prepare reports, transcribe patient interactions, and conduct conversational AI. When we think about the future, we think about physical robots. While they may not be as whimsical as we imagine them, AI can actually bring forth the application of robots to healthcare as well. In the world, today's robots collaborate with humans to make difficult tasks like welding, lifting, reposition, or assembling easier. In healthcare, these themes are seen through interventions such as surgical robots, giving surgeons the ability to see better, be more precise, and be minimally invasive. Common procedures that use robots today are seen through specialized surgeries such as head and neck surgery. Finally, on the back end of healthcare, AI can help automate administrative tasks. Computer programs can be used to ease the burden of repetitive tasks such as authorization or billing. Combined with more technology, we see computerized systems used for things like data extraction and faxing images as well. Artificial intelligence has shown to have massive potential in improving diagnoses within a healthcare setting. Today, image-based AI models are the most popular, where AI is used to make diagnoses from images. Think of X-rays, MRIs, CT scans, mammograms, really anything that involves taking a diagnostic image of an area and making a clinical diagnosis based off that image. The process of developing this sort of AI model is complex for sure, but the concept is pretty straightforward. It's based on a type of artificial intelligence called machine learning, which is broadly defined as a machine's ability to copy human behavior. Machine learning starts with gathering a lot of data. In the case of diagnostics, maybe X-rays on bone fractures, and supplying this data to a computer model to train itself on finding patterns and making predictions based on this data. A human programmer can then also go in and tweak the model, pushing it towards more accurate results. For machine learning, the more data a computer has, the better. This is because teaching a computer to learn is like teaching a child to ride a bike. Just like a child learns to balance and pedal a bike with practice and guidance, a computer learns to recognize patterns and make decisions with data and algorithms. In recent years, scientists have done a lot of research to measure the effectiveness of using machine learning AI to make diagnoses. For example, a study conducted in South Korea compared AI diagnosis of breast cancer versus radiologists. The results of the study showed that AI systems perform significantly better than just a radiologist on their own. Specifically, the AI system was more sensitive at diagnosing breast cancer with the mask, correctly diagnosing 90% of cases, compared to the radiologists who only correctly identified 78% of cases. Moreover, the AI was even better at detecting early breast cancer, correctly diagnosing it 91% of the time, than just the radiologists themselves who only correctly diagnosed it 74% of the time. Clearly, AI has some serious capabilities when it comes to making accurate diagnostic decisions, especially based on medical imaging like mammography. However, it is important to remember that this technology is still in its early developmental stages, and much more research and testing has to be completed before it could be trusted to ever make independent decisions in a healthcare setting. In the present and near future, AI at most could be helpful as a supplementary tool for physicians to make diagnostic decisions. In calling AI a supplementary diagnostic tool, it is crucial to address some common myths, benefits, and challenges that researchers are tackling. Firstly, the idea that AI will entirely replace healthcare professionals is a misconception. Rather than taking over, AI enhances decision-making, much like how diagnostic technologies have improved patient care in the past. While concerns about job losses linger, experts emphasize the indispensable need for human competence in future reshaped roles. Next, there's a notion that AI can outsmart human intelligence. While AI excels in certain scenarios, it is heavily reliant on human-built frameworks and decades of data gathered by researchers. But what about the fear of AI becoming sentient or self-aware? While regulation is indeed crucial, it is essential to understand that AI is governed by human-defined parameters. The real concern lies in how data is produced and applied in algorithms rather than in AI itself. Now, let's dive into the benefits of AI in healthcare diagnoses. By rapidly analyzing diverse medical data, AI significantly reduces diagnosis time across various fields like oncology, radiology, and cardiology. It excels in making correct diagnoses, often outperforming human doctors in speed and accuracy. Although this can be life-saving, it's important to note that AI still relies on previous human interpretations, as it is incapable of interpreting data on its own. Additionally, AI may minimize follow-up appointments by providing personalized health coaching, educating patients to improve lifestyle choices in managing their illnesses. This is especially beneficial for patients struggling with lifelong disorders, whose unique needs are often ignored in Canadian healthcare. By empowering patients, AI can also capture the necessary data to track and cope with their illnesses. However, this data storage requires strict regulation to address privacy concerns. Furthermore, studies have shown AI's potential to provide better care, surpassing physicians in politeness, quality of explanation, clarity, and commitment. These findings underscore the need for ongoing research to provide patient outcomes through early detection, better prediction of disease progression, and personalized treatment plans. Moreover, it offers opportunities to reduce healthcare inequalities both domestically and globally, although implementation of AI itself is sure to be costly. Artificial intelligence is now making waves in the world of healthcare. Machine learning and deep learning algorithms are empowering physicians with personalized treatment recommendations and advanced diagnostic capabilities. By analyzing vast data sets, AI models can identify subtle patterns and make predictions that often surpass human accuracy. Moreover, AI extends beyond diagnosis, assisting in physical tasks through robotics. Yet, as we embrace the potential of AI, we must also address challenges. Strict regulation and data governance are essential to ensure AI's responsible integration into healthcare systems. In conclusion, while AI holds immense promise for revolutionizing healthcare, its journey is just beginning. With continued research, collaboration, and a focus on patient well-being, the full potential of AI can be used to improve healthcare outcomes for all. Thank you for joining in on this exploration of AI diagnoses in healthcare. Stay tuned for more insightful content.